How real is that? I mean, are we really jeopardizing our place in COVAX? I mean, ano ba to? Parang nakakatakot, and I'm sure that's the purpose of telling everyone, hoy, mag-ayos-ayos kayo. Kung hindi, we might lose our place here. But how real is that possibility?
It is real. You know, before we started, before the Department of Health started the COVID plan, really it was stipulated there, and there was this understanding that the COVAX facilities, or what is going to be donated by WHO, should be used only for yung mga prioritized groups na sinasabi. That's why the first step that the DOH did was form the NITAG, and then the NITAG was the one who said, okay, pag-aralan mabuti, these are the priority groups. And you know, that didn't happen overnight. I mean, there was a lot of debate on sino ba may karapat-dapat talaga na mauna, mahuli, and so on and so forth. So it's really unfortunate na, but I guess it's not totally unexpected, but it's rather unfortunate. But the threat is real.
Yes.
The threat is real.
But Doc,
well, not the threat. Yeah.
But Doc, let's bring back, I mean, that process para may konting background tayo. As you said, it wasn't overnight, matagal pinag-usapan yan. I'm sure a lot of people were saying, well, what about this sector? Well, what about this sector? Did local officials figure into that conversation? Because you can make a case that local officials are frontliners as well. Bring us back to those conversations, and how was that framed? How was that eventually resolved?
Well, first of all, we have to have numbers. We have to have evidence, right? Who or what is driving the epidemic and who are most at risk. So, kaya nga sabi natin, health workers, no questions about that. You know? And then comes and then we have to follow also the pattern that is being seen globally. Kung kaya to sinabi ng WHO na in most other countries, you know, second in line, ang senior citizens, and then comorbidities. So we followed. We look at the numbers, and then we follow, you know. And then fourth is when we already try to save the economy, that is bringing the essential workers na sila ang kasunod sa A4. So yun. And sino sa mga essential workers? So panibago na naman na prioritization yan. So actually, when we first presented, because remember that NITAG is recommendatory. When we presented to IATF, they in fact already asked yung mga local chief executives, yung mga head ng mga LGUs, shouldn't they be considered as frontliners, you know, because ganito. Yes, if we had enough vaccine. I mean, if it so happened na ang unang bagsak sa atin is 20 million doses, why not? You know? But the thing is, the first bagsak of the doses wasn't even enough to cover the health workers, and you know that. And that is the reason why we were so very, very particular on talagang sa kanila na lang muna. We have to bite the bullet and say, sa kanila na lang muna.
Doktor, hindi naman sinasabi nila na frontliner sila eh. May nadagdag na naman na 8 ngayon LGU officials na pinatatawag ng DILG, no? Pare-pareho sinabi nila, they want to dispel vaccine hesitancy kasi ayaw daw ng mga kasama nila na parang nag-uudyukan sila, mauna muna kayo. Valid is that? Kasi hindi ba nagkaroon tayo high profile? Everybody was covering the doctors here. Yung official na matataas na lahat sila. Si Vaccine Tsar, si Vince Dizon, saka si Ben-Hur Abalos. Lahat sila in public nagpa-vaccinate with Sinovac. That's very important. So, ano pang may have vaccine hesitancy pa ba?
Ganito yon. Remember na nandito muna tayo dun sa healthcare workers. Okay? So, ang pinakamainam na influencer sa healthcare worker ay mga hepe nila or kapwa-doktor. Diba? So, actually, kahit noon pa, humihirit din na kailangan ng influencers, no? Siguro, yes, I would agree na kailangan ng influencers. Depende dun sa kung sino na yung audience or kung sino na yung susunod. So this early, hindi pa tayo nakakarating sa general population. So I guess to say na they would be influencers for the healthcare workers, sabi nyo nga, meron na eh. Meron na nakapag-influence. Siguro pagdating do sa general population, kahit ikaw, kahit ako pwede, especially you guys, you also have your circles of influence na napaka-importante nyo na pag nakitang kayo na una, marami kayong mapapasunod. So, ganun lang yon. But the thing is, wala pa nga tayo doon sa cluster o sa grupong yon. Kaya, I guess, hindi masyado mag-fluffly yung argument na it's to influence.
Doc, let me put it this way lang po. Benta ba sa inyo yung rason na yun? Benta ba sa inyo? Pag sa inyo ginamit yung rason na yun, hindi, ako yung mayor dito eh. Kailangan kong udyukin yung mga tao. Benta ba sa inyo yun? Would that hold any water for you?
For me, as I said, depende kung halimbawa yung eto na tayo dun sa punto na general population na yung bibigyan natin, especially if that mayor happens to be a very charismatic mayor or talaga may hatak sa kanyang mga constituency, well, why not? Maybe, right? But kaya pinauna ko kanina na sa puntong ito, nasa healthcare workers tayo eh. So siguro yung
all politicians po would use that argument na I'm influential among my constituency. That's why I got elected. Diba? In other words, every politician could use that argument.
Every politician is a legend in his own mind. Ano ba masasabi ko? Again, pabalikan ko, kung talagang sapat lamang sana ang vaccine natin, bakit ba ang hindi? Okay. Lalo pa kung makikita nila na, sige, kung yung vaccine na hindi ko pinagkakatiwalaan, nauna siya, sige, baka sakali, no? But really, it's because at this point, we don't have enough. Baka sakaling come second, third quarter of this year, kapag kasabay-sabay dumating yung in order o talagang on time na dumating yung mga nakaschedule, well, who knows?